Good day, everyone, and thank you for joining our webinar on the Interagency Working Group's hot-off-the-press proposed nutrition principles for marketing to children. My name is Samantha Graff, and as well as being the Director of Legal Research at Public Health Law and Policy, I'm a mother of 2 little boys. So the topic of food marketing resonates for me both professionally and personally. We're a Netflix family, not a TV family, which means my kids don't see commercials at home. So it came as a real shock to me recently when we drove up to the mountains with our 4-year-old, who couldn't read a word to save his life, but somehow was able to identify every fast food restaurant on the road from Oakland to Tahoe. Before we get too deep into the issue of food marketing to children, let me start with a few housekeeping notes. If you're having technical problems, please dial *0 and an operator will assist you. Again, if you're having technical problems, *0. If you're having problems viewing the slides, please contact the WebEx customer support line at 1-866-229-3239. Again, if you're having problems viewing the slides, the number is 1-866-229-3239. Our webinar is being recorded. It will be archived on our website tomorrow, and you will receive an email after the conference is over where you can download the recording. We're going to field some questions at the end of the session, so please take a minute to find the Q&A panel in the lower right-hand corner of your screen. So you get comfortable using the Q&A panel, I want to give you a chance to warm it up. So please type into the panel the name of one food brand you can recognize by its logo initial in the alphabet on the screen. Okay, looks like folks are getting the hang of it, so don't be shy with the Q&A box. Please post your questions for the panelists throughout the webinar, and we'll answer as many as possible at the end. If you have a question for a particular person, please indicate that just so that we can be efficient in the short time that we have together. PHLP's N-Plan program is co-hosting this webinar with the Food Marketing Workgroup, a national coalition of organizations and individuals dedicated to eliminating harmful food marketing. Margot Botan of Center for Science in the Public Interest and Lori Dorfman of Berkeley Media Studies Group co-chair the Food Marketing Workgroup, and they will both be speaking later today. Apologies to those of you who signed up for the original M-Plan webinar on how to limit junk food marketing in your community. But exciting, late-breaking events inspired our shift in focus, and we hope this webinar will give you concrete information about how advocates and local governments can influence important federal policy developments. By way of background, in 2009, President Obama signed an Appropriations Act allocating hundreds of billions of dollars in federal spending. Sandwiched in the middle of this act was a provision establishing an interagency working group to provide industry with recommended standards for food marketing to children 17 and under. This work group was comprised of 4 agencies, the CDC, the FTC, the FDA, and the USDA, as you see on your screen. On April 28th of this year, the working group released a document called Preliminary Proposed Nutrition Principles to Guide Industry's Self-Regulatory Efforts. It contains a section of nutrition recommendations and a section of proposed definitions of marketing targeted to children and adolescents. It also contains a list of 30 questions that the working group is asking the public to answer in comments submitted by July 14th. Today, we will be very privileged to hear from 2 federal officials who were intimately involved in the working group process. Dr. Bill Dietz is the Director of the Division of Nutrition, Physical Activity, and Obesity at the CDC, and he will walk us through the nutrition principles recommended by the working group. Michelle Rusk is a senior staff attorney at the FTC, and she will explain the working group's proposed definitions of marketing targeted to children. First, however, Margot is going to take us through a little bit of context and show us why the food marketing environment is a serious cause of federal concern. So, Margot, you're up.
Great. Thanks, Sam. So there is a lot of marketing aimed at children, about $2 billion worth a year. Kids live in a media-saturated environment where their desire for primarily unhealthy foods is cultivated not only through television ads, which is still the dominant media used to reach children, but also through companies' own equity characters and the use of other characters from kids' favorite movies and television shows. There are also contests, games, and toys on and in food packages. There are ads in children's magazines. Snack brand books are basically ads which turn reading to a child into an opportunity for companies to promote their products. There's lots of different kinds of marketing through cell phones, iPods, and other mobile devices. There's advertising built into games on the internet. Here's an advert game for Reese's cereal. There are also ads that are masquerading as toys, where the toy itself is the marketing for the brand. In schools, there's lots of different kinds of marketing. There's marketing through educational materials and curricula. There are brands and products on signs and posters in and outside of schools. The fronts of vending machines are basically little billboards that kids pass by in the hallway. There's scholarships and sponsorships in schools. There are many companies who use branded fundraisers to market their products to children. The food displays in the cafeteria oftentimes are branded and market products to kids. There are programs that are made to look like philanthropy but really are about marketing, like label redemption programs like this one from Campbell's, their Labels for Education program. General Mills Box Tops for Education is another common one. There are incentive programs like the Pizza Hut Book It program, and many fast food and other chain restaurants provide fundraising opportunities to schools. There's no disputing the fact that the goal of food marketing is to influence children's food choices. The main problem is that the majority of the foods that are marketed to kids are unhealthy. If companies were marketing bananas and broccoli, there wouldn't be any need for interagency working group standards. But instead, companies continue to market mostly sugary cereals, fast food, snack foods, and candies to kids. In 2006, 17 major food companies agreed to, or since 2006, over the last several years, 17 food companies have agreed to scale back their marketing of unhealthy foods to kids through the Council of Better Business Bureau's Children's Food and Beverage Advertising Initiative. So this program is a good start toward self-regulation, but unfortunately it isn't as effective as it needs to be. Studies by Children Now, Bridging the Gap, Rudd, and others show the same, that too much of the food that's marketed to children is still of poor nutritional quality. Here's an example of one of those studies that we did here at CSPI. We found that on Nickelodeon, the most popular children's television station, that ads for foods of poor nutritional quality have decreased only modestly since before self-regulation was in effect in 2005 until after most of the company pledges were put into place. We found that the percent of food ads that are for unhealthy food only went down from 90% to 80%. So it's good to see a little progress. I think that gives us some hope. But given the high rates of childhood obesity and the prevalence of poor nutrition in kids, this small magnitude of change is clearly not enough. One of the key reasons for the poor results is that each company has their own nutrition standards. And while there are a lot of similarities between those company standards, there also are some very strategic differences which accommodate foods in the company's product portfolio. So, for example, cereal companies have reasonable sodium standards but weak sugar standards. McDonald's has good sugar standards, on the other hand, but no sodium standard. In a study that we conducted, we found that the products that the companies themselves have identified as appropriate to market to kids meet the company's own standards. So they're complying with their own standards, but the majority of the approved products don't meet a single third-party nutrition standard, in this case, CSPI standard. And it's not that our standards are so different. It's just when you consistently apply standards across the board, many products don't meet them. So for self-regulation to work, it's essential that companies adopt a strong and consistent set of nutrition standards. And to this end, CSPI worked with Senator Harkin to require the Interagency Working Group standards, which you're going to hear more about in just a minute. A single consistent set of nutrition standards also will make it easier for entertainment companies to apply nutrition standards to their marketing. Some entertainment companies have claimed that they can't apply nutrition standards to their TV, radio, print, and internet ads because they don't want to be the one to determine which products food companies can run through their media. And if they use the company's own standards, each company has a different set of standards, and it can be complex. Getting more entertainment companies to address food marketing is really important. Currently, only 20% of media companies that market to children have a policy and are addressing food marketing to kids. And usually those that do have a policy on food marketing only cover the use of their licensed characters. They don't cover their television, radio, magazine, and internet sites. The Interagency Working Group standards will also outline which media the nutrition standards should apply to, and the proposal defines which should be considered directed at children. This is really needed because most company marketing policies don't cover all types of marketing. Most cover television, radio, internet, but they don't cover marketing through middle and high schools, on-package marketing and in-store displays, toy giveaways like the toys that are given away with fast food meals, toys based on branded products like Pizza Hut play sets, and the use of company logos, product names, or spokes tunes on merchandise like cereal, bowls, and T-shirts. So I am now going to turn it over to Dr. Bill Dietz so we can hear more about the proposed nutrition principles. Bill?
So I wanted to begin by thanking again NPLAN for hosting this conference and allowing us to provide more information on the background and rationale of the activities of the working group. This is the charge of the working group. We were directed in considering such standards to consider the positive and negative contributions of nutrients, ingredients, and food, including calories, portion size, saturated fat, trans fat, sodium, added sugars, and the presence of some of these more positive elements like fruits, vegetables, and whole grains to the diets of children. And secondly, the evidence concerning the role of the consumption of nutrients, ingredients, and foods in preventing or promoting the development of obesity among such children. And finally, we were directed to determine the scope of the media to which such standards should apply. Now, there's abundant evidence that food marketing has an influence on the choices and diets of children and adolescents. These are the findings of the Institute of Medicine report on food marketing to children and youth in 2005, which found that there was very strong evidence that food and beverage preferences and purchase requests and short-term consumption of 2 to 11-year-olds was influenced by food marketing. There was moderate evidence that food and beverage beliefs and usual dietary intake among 2 to 5-year-olds was also influenced. But there was insufficient evidence at that time that a causal relationship existed to explain the linkage between TV advertising and adiposity. It's clear that there is a relationship between television viewing and obesity, and increasingly evidence points to the effects of television advertising on food consumption rather than displacement of physical activity. But at this time, the IOM report concluded that there was insufficient evidence. When we looked at the approach that we ought to adopt, we thought we needed to focus on the categories of foods most heavily advertised to children and adolescents, and those are shown on this slide. These are slightly different in terms of the frequency of advertisements directed at children 2 to 11-year-olds versus 12 to 17-year-olds. But cereals, snacks, candy, dairy, baked goods, beverages, fruit juice, prepared foods and meals, frozen and chilled desserts, and the restaurant foods were what we focused on in the development of these standards. There's also a strong science base already available on what principles we needed to consider in the development of these recommendations. So we looked at current regulations for health claims and nutrient content claims. We began when the 2005 dietary guidelines were still in place and updated those recommendations according to the Dietary Guidelines for Americans released in 2010. We also had the advantage of a number of very important and comprehensive reports from the National Academies of Sciences Institute of Medicine, specifically the dietary reference intakes, nutrition standards for foods in schools, and strategies to reduce sodium intake in the United States. We were very concerned that our effort not be designed to say what children should or should not eat, but rather what should be advertised and to guide their choices in a healthier direction. So Principle A and the underlying consideration of our recommendations was that foods marketed to children had to provide a meaningful contribution to a healthful diet. And there were two choices that we posed in the report. Option A was based on the fact that the food needed to contain at least 50% by weight of one or more of the following ingredients, which were the foods that we wanted to promote through the Dietary Guidelines for Americans, namely fruits, vegetables, whole grains, fat-free or low-fat milk or yogurt, fish, extra lean meat or poultry, eggs, nuts and seeds, or beans. And a food group had to have a significant proportion of two of these different, the main dish had to have had to be composed of two different food groups and the meal of three different food groups, but still had to meet this principle of 50% by weight. The second alternative that we posed was based on the RAC, that is the reference amount commonly consumed. And this is the usual intake of these foods over the course of a day divided by 4 to allocate on a regular basis. And you can see here that this was volume-based rather than weight-based. So half a cup of fruit or fruit juice, and you can just scan down and see what those equivalents are for vegetables, whole grains, milk or yogurt, etc. Now, the other concern, though, was that there were significant nutrients that had an adverse impact on health, and that those foods that were promoted under Principle A also had to meet Principle B, and that's that these foods marketed to children should not contain more than the following amounts of these nutrients. So we set saturated fat at less than or equal to 1 gram per rack and less than 15% of calories. That's low fat. Trans fat was 0 grams per rack, which technically is less than 500 milligrams. We set as the limit for added sugars 13 grams of added sugars, based on the fact that a quarter of discretionary calories in a 2,000 calorie diet were 267 calories spread over 4 servings was less than 13 grams, and that sodium should contain 140 milligrams per rack ultimately, but a 210 milligram interim level. And a main dish would have a goal of 300 milligrams with an interim level of 450 milligrams. And here, again, is the rationale for those nutrient limits. I think I muddled what I said about the sugars, but this shows it quite clearly that it's a quarter of the 267 discretionary calories, and divided in, that makes about 13 grams of added sugar. The sodium requirement is lower than that recommended in the dietary guidelines, but consistent with the low sodium. And we base that principle on the fact that an adequate intake for children 4 to 8 years old was 1,200 milligrams with an upper limit of 1,900 milligrams. And the for 9 to 13-year-olds, the corresponding values were 1,500 milligrams and the upper limit of 2,200 milligrams. And we were particularly concerned about sodium not only because of its impact on elevated blood pressure and ultimately hypertension in children, but because the taste for sodium is established early. And we wanted to minimize sodium preferences so that as children grew, they would be acclimated to the taste of a lower sodium food supply. The next steps are that the comments have been posted for comment on the FTC website. This is the website that I'm showing here in the slide. We had a public comment meeting yesterday, 2 days ago, at HHS, in which there were 22 comments from both supporters and critics of these standards, all of whom have pledged to provide written comments when the comment period closes on July 4th. And there is a website on the FTC website where those written comments can be submitted. So it's now my pleasure to introduce Michelle Rusk, who's an attorney in the Division of Advertising Practices at the FTC, and who really provided extraordinary leadership for this working group, which was a very cohesive and productive activity. Michelle?
Thank you, Bill. If the web producer's on, I'm not. Okay. Okay, there you go. Never mind. I was trying to advance the slides. I appreciate Bill's introduction, and I will say that it's been a really wonderful experience working with all of the representatives of the other agencies on this, and learned a lot about nutrition along the way and children's health. Bill spoke about the proposal for the nutrition principles that we are hoping would be goals for the food companies in determining ideally which foods they would be marketing directly to children. So what I'm going to do is talk about the other piece of this, which is the marketing definitions that would be covered, the marketing categories that would be covered by our proposal, and also what criteria we're proposing to determine when those activities are targeted to children. The working group is proposing to use a template that the FTC developed as part of its 2008 report on marketing food to children and adolescents. And the reason we chose to do that rather than reinventing something is that those definitions have really already been vetted through the process of conducting that study, and they have been published for comment in the Federal Register notice. It's something that many of the large food companies are now familiar with because they've been submitting data for our study. And we think that it does a good job of capturing the full scope of marketing to children. I think the first important point about our proposal is that it encompasses both children 2 to 11 as well as older children, adolescents aged 12 to 17. We recognize that obesity rates are high in both populations and that food marketing directed to both age groups is substantial. And I think Bill mentioned that this was clearly part of our directive from Congress that we would consider marketing to both children and teens. The second point is that our proposal extends beyond television and other traditional media and some of the other activities that the industry self-regulatory programs are now covering. And we actually have proposed 20 different categories of marketing activities, including a catch-all any other promotional activities. For the criteria that we are proposing for what would be targeted to children and teens, we've included a mix of objective standards where they're available, things like audience share for television programming, also subjective indicators of the appeal to children and obviously company intent if the marketing plan suggests that this is a campaign targeted to children. So it's any or all of those mix of objective and subjective criteria. These are the categories of covered activities, and I'll go through them quickly. I think television, print, radio are self-explanatory. By company websites, we mean the sites that are actually created and controlled by food companies, where there are activities. I think Margot highlighted some, like the virtual worlds, the advergaming, online sweepstakes and contests. Other Internet advertising refers to anything else on the Internet, like banner ads, pop-up ads, ads in social networking sites. Movies and video games, by that we're referring to the ads that you see in the theater before the movie, or they're placed at the opening of a video or video game. So that's not to be confused with product placement, where images of the food or other references like logos, signage, are actually embedded in the music or movie or video game. And that includes product placement, whether or not it's procured by the companies or just permitted by the companies. Other digital advertising would refer to things like ads through PDAs or cell phones, texting, instant messaging, mobile downloads, podcasts, packaging and labeling and in-store promotion, I think, again, are self-explanatory, but it would include the in-store displays and free sampling in the retail outlets. Specialty items and premiums, I think the most obvious example of that is the toy that comes with the kids' meal. Another example would be sweepstake prizes. Promotion or sponsorship of entertainment events, another category that we cover. Character licensing, cross-promotion, toy co-branding. We see a lot of cross-promotion or licensing of characters from popular kids' movies to promote food to children. And the toy co-branding is a little different from the premium toys. It's things like the McDonald's Barbie doll and the counting books that Margot showed on her slides. Promotion or sponsorship of sports teams or child athletes. Word-of-mouth marketing, where the company provides samples or incentives to a non-employee to encourage them to promote the product to their friends. Viral marketing is similar, but the company's providing actual messaging or content to be passed along by third parties. So an example would be something like a send to a friend email message. Celebrity endorsements are also a technique that are covered. Sponsorship of fundraising and philanthropic activities. The in-school marketing that Margot highlighted, I think a lot of the self-regulatory programs now cover in-school marketing, but our definition is somewhat broader than the pledges of many of the companies, so it would include the logos and signage on the vending machines or on the displays in the cafeteria. It would include branded equipment, other curriculum materials. It would also include the charitable fundraising. And then that last category, any other promotional activity that is intended to reach children. So those are the categories. The criteria, we actually have criteria for each category and separate criteria for what constitutes targeting to children or targeting to adolescents. And I'll go through some of those now. The details of all of this are in our 2008 report, which is posted on the FTC website and is also linked from the interagency working group proposal. For TV, radio, and print, the primary determinant is the audience share based on, measured on an annual basis. For children, at least 30% of the audience age 2 to 11. For teens, at least 20% age 12 to 17. The rationale for that is that represents double the proportion of the age group in the general U.S. population. So when you look at what programs that would actually cover, it is clearly child-directed programming. For movies, videos, and video games, we're applying the same 30% and 20% thresholds, but we're also adding an alternative standard, which is tied to the industry rating codes. So for children, it would be an E-rated or lower video game or a G-rated movie. For teens, it would be an E10 rated or younger video game, a PG-rated movie. Again, these are either or, so you could potentially have a PG-rated movie with a 35% share of kids 2 to 11, and that would be something we'd consider child-marketed. For sponsorship of entertainment events, sport teams, philanthropic events, again, the same age thresholds for either participants or a fan base for the sporting events. And also an alternative determinant would be whether the company actively sought the participation of children or teens in the activity. For company websites and other internet ads, our thresholds are a little bit different. We're basing the threshold on the population of active internet users. So the 20% age 2 to 11 for both children and teens represents double the proportion of that age group among active internet users. So it's the same rationale, it's just using a different base population. And again, that's audience share that is measured on monthly visits to the website. Other digital advertising, word of mouth, and viral, we're using that same 20% threshold that we apply to internet advertising, and also the alternative criterion of knowingly seeking participation of children or teens. And then finally, for all of those covered activities, we will also propose to look at the company intent. So if a food company has a marketing plan that a specific campaign is targeted to children or to adolescents, that obviously is an indicator. And also, except for TV, radio, and print, where we feel like we have a very good objective measure of what's child-directed, for all of the other covered activities, we are proposing to look at the subjective appeal to children and teens. So are there animated characters, celebrities popular with children, language in the content that refers to child, kid, teen, what are the age of the models, the actors, or the characters used in the marketing activity, or any other child-oriented theme. So what we're saying is that any of these criteria, whether they're the objective measures or the more subjective indicators, should be looked at to determine when something is marketed to teens or to children. We have listed a number of questions that we are seeking comment in as part of our proposal. There are many, many questions related to the specifics of the nutrition principles that Bill went over, and also questions on the marketing definitions. One of the key questions has to do with the scope of covered marketing activities for teens and whether it may be appropriate to somewhat narrow that category of marketing, perhaps to in-school or to in school on social media. And also we have questions about whether we have the right mix of criteria to capture child and teen-directed marketing. Are the percentages that we're proposing over and under inclusive, or are there better objective measures to use rather than audience share? So with that, I think I will turn it over to Lori. I will just say that we will be putting a transcript up of our forum from Tuesday along with the presentations from that forum. Our comment period for the proposal now ends July 14th, and we are eager to get input from everyone before we prepare our final recommendations to Congress.
Great, Michelle. Thank you. This is Lori Dorfman. I co-direct the Food Marketing Work Group with Margot Lutan, as Sam said at the beginning, and we're eager for those of you whose organizations aren't members and are interested in it to contact us. I'm going to say the email address twice right now at the beginning, and then I'll say it at the end. If you're interested in the Food Marketing Work Group, please send an email to nutritionpolicy, one word, nutritionpolicy at CSPINET.org. Nutritionpolicy at CSPINET.org. And I'm eager to have some discussion here. We've had a couple of questions come up on the board. We'll get started with those right away, and then if you have other questions, we'll try to get to as many as we can. And the first set of questions that I have are for you, Bill, about some of the details about the decisions you made around how to characterize the portion of food. One questioner is worried that the document jumps back and forth between using the rack as a reference, and portion sizes as references, and but consumers are most familiar with the food labels on the packages, and the questioner is wondering, shouldn't that be the consistent guide? So I'm wondering what you think about that, and how, maybe just a few words about how you guys arrived at the rack.
Well, I don't think I was as clear as I should have been when I was describing those. Those are alternatives that we're asking industry to respond to, and they reflect differences in the way the FDA and the USDA categorize portions in food. So USDA uses servings, 50% of a serving, and the FDA uses a rack, which is based on the distribution food intake over the course of a day divided into 4 meals. And the committee considered both of those options. And
so, Michelle, while you're here and we see your lovely picture, let me combine a couple questions that have come up to ask you. One is, one questioner is, I guess, maybe confused about this because parents are the ones who decide what kids eat. So I wonder what you're thinking about this is in regards to parents. And kind of in combination with that, and along the lines of what Bill just said, these are suggestions. These aren't requirements. So what do you think it's going to take to have companies comply with them?
Well, I think that the first piece of that question raises a very valid issue, which is that parents, I think we all recognize parents are ultimately responsible for deciding which foods their children should be eating. And the proposal really is about trying to get the food industry to support the healthier choices and to support the parents' efforts to get their kids to eat healthy, rather than undermining them by, just the ubiquitous advertising and marketing of foods that aren't really ideal nutritional quality. So it's really about supporting parents' efforts, not intervening in what they decide to do. And then on the issue of, and by the way, we know that parents now consider childhood obesity to be the top health concern they have for their children. A recent survey showed it's even surpassed drug use and smoking as a health concern among parents, and they consider food advertising to be part of the problem that they're facing. So I think the public concern is there about what is being marketed to kids. In terms of compliance by the food companies, as Bill just said, we've seen a lot of major food companies really step up to the plate already and implement some pretty dramatic changes in what and how they're marketing to children. I think what we're hoping to do with this is create a uniform set of standards that all of the companies would be following and to really set some goals for them as they reformulate and introduce new products into the market over the next few years. And we're hopeful that their self-regulatory progress will continue. I think we know the goals are pretty ambitious, and that's why we've proposed a 5-year implementation period.
So that will give them time to sort of figure out how to do this well.
Right.
Could I? This is Bill. Could I just add to the first part of Michelle's response that to remind people that the Institute of Medicine's food marketing report pointed out that there was very strong evidence that food and beverage purchase requests were driven by children, and that's a consequence of the ads. And the ads are not necessarily promoting foods that are necessarily healthful for children. So I think parents need support to help them make the right choices for children. And given how busy parents are and how stressed they are, having conflicts about what food to buy is a conflict that parents can avoid. And our hope is that by prompting requests for healthier food, that not only will children have healthier diets, but some of those conflicts will be avoided.
That's great, Bill. Thanks. And while we're on this strain of thought, another question has come in asking why, if indeed obesity is one of the most serious things we're facing right now, if that's, Michelle, as you said, what parents consider one of the most serious things, tell us a little bit about why these are voluntary.
Well, I think for a couple of reasons. One is that we're hopeful that the self-regulatory approach will work because we've seen the industry already respond to our earlier reports on this issue and come up with a pretty significant set of pledges. So we're hopeful that it will work. We feel like if it's a voluntary approach, it's more likely to be accepted by the industry. They're more likely to use their creative know-how to influence children's diets for the better. And frankly, if we were to regulate and try to restrict the advertising of certain foods, I think inevitably we would face challenges under First Amendment law on restricting commercial speech.
So right now these are just guidelines saying to companies this is the best that science has to offer. We've sifted through this for quite some time and are getting some ideas about what makes sense based on that to market to kids. And now you're asking for comments about what you've come up with to set up some guidelines that they could follow voluntarily.
Right. These are really goals for the industry self-regulatory programs that Congress asked us to set goals that would promote children's health and reduce obesity. And this is, I think, the best thinking of the agencies with the health, nutrition, and marketing expertise about if you really do want to influence children to eat better and improve their health, where do you need to set those goals? And this is where we think the goals should be set.
That's great. And then the next question that I'm picking out of the list here is
maybe for you, Margot, I know you were starting to look at this, or maybe Bill, and the question is, do you have examples of foods that are currently marketed to kids that under these guidelines, at least the way they're proposed right now, would not be marketed to kids? Do we know that yet, Margot?
Well, I think there are a number of products that couldn't be marketed to kids voluntarily under the current nutrition standards, but many of them are quite close. So, for example, with cereals, many of the cereals that are marketed to children, in the past they were quite high in sugar. They, often had 13, 14, 15 grams of sugar per serving. And over time, because of the interest in childhood obesity and the focus on food marketing to kids, a number of the big companies have been reformulating those cereals, and now they've brought them down to closer to around 10 grams of sugar. So they've gone from about 15 grams to 10 grams. So under the proposed nutrition principles from the interagency working group, they'd have to get down to 8. So while many of the children's breakfast cereals wouldn't make it as they're currently formulated, they're not far away from what the standard would be. And looking at the progress that companies have had in the last 5 years of reformulating cereals aimed at kids, I think that, in a few years, many of them would make it.
That's great. Thanks, Margot. Bill, did you want to add anything to that, or does that do it for that question?
No, only that we, as we went along looking at the kinds of principles that we were thinking about, we tested a large number of foods against these principles and found exactly what Margot described. And so rather than cite specific products, I think there are a number of categories of foods which are already close and with modest reformulation would make the cut.
That sounds very encouraging. There has certainly been some news coverage about this, and I know you probably had quite a lively forum on Tuesday when this was discussed, and one of our questioners wants to know about how the industry has responded so far. Are you seeing encouraging signs that they indeed want to be part of the solution here? That can be for Michelle, Bill, Margot.
Well, maybe it's easier for me to answer.
Go right ahead,
Margot. I was at the forum this week, and I have to say I was really disappointed with the industry response. What I had hoped was that they would make very specific recommendations of, maybe if you change the sodium limit from 140 to 150, we could do it, or, constructive specific points. But instead, the reaction was very negative in a very kind of general, unproductive way. And many of the companies said the same things over and over. The nutrition standards are too strict. The marketing definitions are too broad. And there was voicing of opposition, but not very many constructive comments on how to make the system workable. So I'm hoping in their written comments that the companies will do better and provide more constructive feedback.
And one of our questioners was noting that the government agencies that came together to put these guidelines together was a nice mix across the USDA, FDA, CDC. And I'm wondering what you're hoping to get in terms of comments. The question is that while they understand work group, they want to know how people who aren't inside of agencies concerned with these issues professionally can comment. So I know you're eager for that, and I guess from Michelle and Bill, I'd like you to say what you're hoping to hear from people in the comments. You want to start, Michelle?
Sure. I think we're hoping to hear from all of the stakeholders here, from the food companies themselves, individual companies, about how the nutrition principles would impact their product line specifically, about the challenges that they may face in reformulating. We realize, for instance, that the sodium thresholds will be a challenge for people is particularly for certain kinds of products. We want to hear from all of the public health advocates and their concerns about whether the proposal is missing certain marketing activities, or whether you have concerns about the nutrition principles not being adequate to really promote better diets. And we want to hear from any individuals who have thoughts about the matter. We had some interesting input from pediatricians at the forum on Tuesday, and I think that's a group that would be great to hear from. And I think Margot's right in terms of the negative comments that we heard generally on Tuesday from the industry, but I think all of those comments were coming from the industry trade associations. There were not, to my recollection, comments made by any individual food companies. So I'm hopeful that the comments we get from individual food companies will be more specific and more constructive in terms of the actual proposal.
Thanks, Michelle. Bill, did you have anything to add to that?
Yeah, there are very substantial questions that are raised in the body of the document for which specific requests for responses are made. But I wanted to reiterate our thinking about why we established the principles as we did. We based this on what we thought was the best available science and what would be best for the health of children. And what we heard from some industry on Tuesday was that our principles were unscientific. But what I would hope that companies would do would be to show us where there's better science. And if they've got data that contradict our conclusions, I'd like to see that, because I think that we all have the health of children as a high value. And what we want to do is to do the best thing by children, and would like to see, I would personally like to see the concerns raised about the principles that we established reviewed on the basis of science rather than more non-specific claims about the lack of science that we applied.
Bill, that's a great point. Thanks very much. And Sam, before I turn it back to you, I just want to say thank you for everybody for being on the webinar, and thanks to NPlan for inviting the Food Marketing Work Group to co-sponsor it. We are a group that is dedicated to doing something about harmful food marketing targeting children and youth. And if you want to join us, please, if your organization is interested, for example, in becoming a member of the Food Marketing Work Group, do contact us. And if you're interested in hearing about the comments that we'll be submitting, because we will indeed be submitting comments, just let us know. I'm going to repeat the email address again if you would like to have your organization become a member or hear later about the Food Marketing Work Group's comments on these guidelines. The email address is nutritionpolicy@cspinet.org. Nutrition policy, one word, at cspinet.org. So I want to say thank you very much, and I'm going to leave the last few minutes for Sam.
Thank you, Lori. I just want to extend our enormous gratitude for Bill and Michelle for taking the time to present this information to us today, and for their really openness about responding to some of the tough questions that were floated today. So thank you very much, especially after the tough day you had yesterday or Tuesday, for joining us today. And Lori and Margot as well, thank you very much for representing the Food Marketing Work Group on this call and for your participation. And again, just one last time, for folks who are wanting to get more involved and in this particular process of submitting comments or in general on the issue of food marketing to kids, please email nutritionpolicy@cspinet.org. Thank you very much.